Hi, my name is Rachel Tomasewski, and I'm one of the therapists here at In Step with Horses. I often see clients that have been to therapy before and they just haven't found it helpful for them. And sometimes they believe that they're just not meant to get better, which is simply not true. You're never too old or too young for therapy. The main question that someone needs to ask themselves is, was there a distressing event or a traumatic memory that happened before the age of 25? If the answer is yes, then often traditional therapeutic modalities like cognitive behavioral therapy or dialectical behavior therapy, or what we like to call talk therapy, generally are not going to be beneficial. And the reason for that is the way that trauma is stored in the brain. Trauma is stored in three separate areas. Our reptilian brain houses all of our physiological memories of a traumatic event. So that could be a racing heart, sweating, a tone of voice, the way someone looks at us. That's going to be recorded there. Then we have the mammalian brain, which houses all of the emotions about the event: anger, anxiety, fear, depression. That's stored in here. And what's important to note about these two parts of the brain is that they lack the ability to communicate and have no linguistic properties. And the primary parts that we use, the reptilian and the mammalian brain, are what we have when we're in a high stress situation and can't describe it in words. So with that in mind, we tend to see clients that have had trauma but cannot do talk therapy because they don't have the communication skills to deal with that. So they are accessing the last part where trauma is stored, which is the neocortex. And this is where the thoughts about the event are. I should have known better. I'm broken. I'm not safe. This portion of the brain is not developed under optimal circumstances until the age of 25. And this is where we finally develop language and time. And if a trauma or distressing event goes unprocessed, it's also important to note it remains at the language and the communication abilities of the age it was experienced. So an example of this would be if I was abused or maybe in a car accident when I was 10 and I never processed it, well, it remains with the capabilities to explain it as that of a 10-year-old, even though I'm no longer 10. And that is why therapeutic modalities like equine-assisted psychotherapy, art therapy, EMDR therapy are so helpful for these individuals. They allow these traumas to be processed without the use of words. These therapeutic styles are equally beneficial for children and adolescents who also are lacking full linguistic and communication capabilities. They provide a safe, explorative, healthy environment where they can start to talk about these distressing events and not feel pressured to have words to describe them.